Hey everybody, welcome to another episode of Same Storm, Different Boat. We are honored today to speak with Tonya Winders. She is the president of the Allergy Asthma Network. We were blessed to be part of something last year in May called Capitol Hill Day, where people from the organization and actual patients with asthma, with Rhonda's condition, which is AERD, which is a tri it has three factors that come together in the syndrome, asthma being the ultimate last issue. We were able to go to meet with three of our state representatives, one senator, two representatives, speak to their staff and basically explain what was going on and why there needed to be so much more attention to asthma in general across the board. This year it had to be virtual, so welcome, Tonya. It is great to see you.
Thank you. Thanks for having me and inviting me on today.
And the virtual Capitol Hill Day happened this morning, so we are fresh on the heels of that.
Yeah, just about 2 hours ago, we just wrapped up.
Amazing. We had never walked the halls of Congress. It was an amazing experience to go into the Senate building, the House chambers as well. And we even went to the Senate chambers and sat upstairs and watched the Senate in session voting on a appellate judge. So all the senators were there, I think almost 100% attendance. So that was fascinating. Please take it from here and tell us, how did you do this online with all the information you have to pass on?
Well, of course, 2020 is definitely a year like none other, right? And so this is our 23rd year to host Allergy Asthma Day on Capitol Hill. And that is always done typically the first full week of May and in person in Washington, D.C. This year, because Capitol Hill is actually closed down and only members are allowed to be on the Hill at any time, we decided to delay it until today, May 20th, 2020, and we actually did it as a webcast. So we did a virtual Hill briefing at the noon hour Eastern time today, where we had some recorded messages, but also some live messages from various esteemed members and experts in the area of allergy and asthma.
It's, I just kind of want to reiterate too, how powerful this day is when you are at Capitol Hill, because AAN, it not only supports all causes related to allergy and asthma, but you also advocate for patients' rights, for affordable care, for affordable medication, for care in general. So this day is monumental in putting out the word to our lawmakers of what's needed in the allergy and asthma community. So I just wanted to make
Thank you, Rhonda. Yeah, I mean, I think that lawmakers expect us, right? Every May, they know that we're coming in full force. They know that several hundred people are going to be walking the halls and banging on their doors and putting those issues at the forefront of their minds. And, you know, again, our federal decision makers are tasked with so many different decisions and important policies. And we want to be sure that they know what means the most to our patient community. And so that's why we make it such, such a commitment and such a habit of walking the halls, of bringing people to DC, and of really raising that patient voice. And I'm sure that you and Wayne can attest, I mean, that first time, it is a little bit intimidating, right? It's a very large facility to navigate, and you aren't quite sure how you'll be received. But after you do it one time, we find that people sort of get bit by the bug, if you will, of advocating and really understand that these are people just like you and me, and that they respond to the same things we respond to. Certainly the heart of a patient and of a patient experience and a loved one, but also just the facts, the evidence about what really matters and what's important, and how policy and laws should support that. And so every time we go with that emphasis on the emotion and the heart of the patient, but also with the facts and the evidence and the difference that it's going to make on an economic or cost savings level as well.
The heart issue and the reaction of the actual real people that you just mentioned. Couple things I wanted to do. First of all, every single person we talked to either had an inhaler with them. We found out that our state representative from here in our district in Arizona spent the first 5 years of his life in an oxygen tent because his childhood asthma was so bad. It was amazing to me that every single office we went into could relate on a real level because they had experienced their own problems with the problem of asthma. Before we go any further, this platform is so great to have you say those bullet points. One of them being that, of course, childhood asthma is the major reason for truancy and missed classes. But
so the number one reason kids miss school in our country is asthma.
Right.
That's the number.
And but the other stats, just the bullet points that you had that we were made aware of course, our situation is she has an asthmatic condition, and as a spouse, I've seen it take us to the emergency room multiple times while on tour, being questioned about what drugs we were on because it was a musician riding in the ambulance. So we have experienced it firsthand. But to people who are brand new to this thing, just hit us with those the quick bullet points that we all know.
Well, there are 25 million Americans currently living with asthma, and about 50 million Americans that live with allergies, asthma, and related conditions like the condition that Rhonda has, AERD. So there are, that's 1 in 6 or 7 Americans that are impacted by these diseases. So everyone knows someone. Absolutely. And then I think one of the most astounding things is the cost to our nation. So we know that each year allergies and asthma cost our nation over $100 billion, billion with a B, that is. And so again, these are very important health issues. And of course, in light of COVID-19, even more important because we know that those living with chronic respiratory conditions like asthma, COPD, or AERD are actually at higher risk for complication due to COVID.
Go ahead.
Oh, I could go ahead. I could go all day. To the last point that you just said, since we've been in quarantine, I turned 70 in a couple of weeks, so I'm in the high risk.
Happy birthday, almost.
Thank you.
I can't believe you're almost 70. I don't believe it.
You think you can't. But the other thing too that we are ultra scared of is going into public and either I bring the virus home to her or whatever. It could be a struggle for me. I understand. It could be deadly for her. So that one hit us especially hard. What you just said, COVID-19 to us is a potential death sentence, not just the flu. It's not just a chest cold. It's a potential death sentence. The other thing that I wanted to bring out, and then we'll move on with other questions. The biggest reason for children missing school and the least attended to issue on a school campus, I was blown away to find out that there are only 3 states that will allow certain school districts to even have an EpiPen in the school nurse's locked up medicine cabinet because they're worried about abuse. Whereas a teacher lost her job by saving a kid's life because she administered her EpiPen to save the girl's life and then was fired.
Yeah.
I just want everybody to digest that.
Part of the policy issues and challenges that we are really fighting for in our work at Allergy and Asthma Network. It's why it's one of our core mission areas, because we know that schools need to be equipped with these emergency medications like epinephrine and albuterol, and yet so few schools truly are. And then when you go to the thought of the lack of school nurses and support in training of recognition of the most common reason that kids miss school, it's really astounding to think of that. And so that's why, again, we've been working not only at the federal level, but at the state level to ensure that patients can get access to their medications, that they have the right to self-carry their medications if the doctor and the parent feels that they're able to do so, and definitely that school personnel are trained consistently.
Right, right.
It's you made a comment about attending Allergy Asthma Day Capitol Hill and getting bit by the bug. And
Yes.
That's exactly what happened to Wayne and I, because it's quite astounding that people don't realize these statistics that we're talking about. And they don't realize the work that needs to be done to correct some of these statistics. And I say all of that because we were going into this year, we were so looking forward to being there in May, on the 5th and 6th. And it's a big year for AAN.
I hear there was going to be a concert too.
Yeah, there definitely was going to be a concert, and there's going to be a concert because we are definitely going to have a party like none other when it comes to May of 2021. But, it was very disappointing for us. Back in mid-March when COVID hit, we had to make the decision to go to a virtual event and to cancel or postpone our gala and benefit concert with Little River Band. And it was honestly one of the most heart-wrenching days for us as a team because we were so looking forward to that celebration. 35 years is the major milestone, and the work of the network is to be celebrated. And so we're so looking forward to May 5th of 2021 when we can gather back in DC and go forward with the plans we had.
We will do
and do it again. Absolutely. Did you sense that making that transition to a virtual day, did you sense any less enthusiasm, or was it harder to get motivated to pump it up, so to speak?
Well, I don't know that, again, our motivation every day is the stories that we hear from people just like you guys, right? So there's plenty of motivation on a day-to-day basis, but I think in this period where we all feel disconnected, that it was challenging to promote the day, and we really had no baseline expectation of who would participate. And so to get on the line today and see 250, 300 people on the line, and then hear that they are sending emails and making calls to their congressmen and women, that was just so encouraging and reassuring, and definitely helped us to know that we did the right thing by moving forward.
Do you happen to know, were there any, before we pushed the record button, you had mentioned a couple of people that were in attendance?
Yes, yeah. So we had Representative Elliot Engel from New York, and Representative Engel actually is the chair of the Asthma Allergy Caucus in the House of Representatives. And then we had the president of the American College of Allergy, Asthma, and Immunology, Dr. Alan Meadows from Montgomery, Alabama. And we had a patient, Emily Lentz from New York City, who actually lives with severe asthma and survived and has recovered from COVID-19 there in Manhattan.
Wow, I bet that's a powerful story.
It was really great.
Yeah.
Really great. And then the final speaker was actually from the asthma guidelines expert panel. We have a new update of the US asthma guidelines coming out this fall. And so we got the latest news from NIH on the research and advancement of the asthma guidelines.
One thing that we also learned last year when we were there was that asthma and related diseases hit ethnic communities harder than Caucasian communities. The same thing is true of COVID. Was that expressed today, and how are you reaching out to those communities?
Yeah, so that has always been, again, at the heart of the work that the network does. We know that there are great disparities when it comes to asthma and allergy care. In fact, African Americans are 7 times more likely to die from asthma than Caucasians, and Puerto Ricans are 4 times more likely to die than Caucasians. So we definitely have specific programs that are intended to reach the African American and Latino communities specifically. And today we did discuss the disparities and how it's impacting communities, not only with the chronic disease, but also in light of COVID. And I think that is one of the positives that has come from the COVID conversation. We know that these social determinants of health are vitally important and that we have to address them. Like, no longer is it okay that your zip code is the #1 factor for the level of care you receive.
Right. And I know, just living here in Arizona, our Navajo community has been hit incredibly hard with COVID. And again, we see a lot of asthmatics and people with these chronic life-threatening illnesses, allergies and asthma. And so, being able to reach out to those communities and to bridge that gap is a huge plus. Even though we had to learn some of it through this pandemic, it is a plus that we've been able to close some of these gaps with these.
Absolutely. That's why I love even the title of the podcast and the way that you guys are reaching out into the community, because yes, we're all in the same storm. I mean, we're all weathering this storm together in some ways, but each of our unique experiences is different. And, you guys know I travel all the time with my job, both US and internationally. I have not been on an airplane now in 10 weeks, which I have not gone that length of time without getting on an airplane in over 15 years.
Wow.
Yeah.
So,
Yeah.
I mean, I know you can relate, right? Because you guys
Absolutely.
live on the road too. And so just that very challenge of being in the same place day in, day out for now 10 weeks, and the way that impacts, the dynamics of your family and your health and your mental health and all those things. I mean, I think it really has resonated that, yes, we're all in this storm together, but we all are walking very different experiences.
Has AAN found it challenging to connect to some of those ethnic communities for sheer fact of lack of Wi-Fi, lack of devices? Some of the work you guys do is literally on the ground with different organizations. Yeah. So now that can't happen, are you finding, and how are you meeting those challenges?
Yeah, it really has been very difficult. I think that #1, we've partnered with local community-based, champions and advocates. And so while we can't go into a community, we certainly know who the asthma champions and asthma advocates are in a community, and reaching out to them, supporting them with low literacy materials, with free medication and education resources. Those are some of the ways that we've tried to make sure that everyone can get access. And then, we know not everyone has great Wi-Fi or a smartphone. So even sending out alerts that are printed and getting them into community centers has been an important aspect of the work as well.
One of the podcasts that we did was with some friends of ours from Chicago who are very, very heavily experienced as principals in the Chicago school district, and we were talking about the fact that there are communities. We assume that kids are techie and are going to get this and just adapt to it, and they made us very aware that some of them don't even have the devices, let alone know how to run them. They don't have access to this.
Right.
And on a personal note, because you've traveled so much, your existence now with AAN is virtual. Your kids are doing virtual school. How is all of that merging together there? How's your bandwidth? What's time like there?
Well, thankfully, so my children now are young adults and teenagers, so it's a little bit different. I've said numerous times over the last 10 weeks, I can't imagine having lived through this when my kids were younger, right? Because just trying to balance work and family, and even just ensure that everyone has enough bandwidth to do their schoolwork and also do their actual professional work has been challenging at times. But, you know, I'm so proud of my girls and my husband, and, you know, the way that our family has really grown stronger during this time. We've had more family dinners. We've definitely played outside and played board games and done a lot of things that, quite honestly, perhaps we were just a little bit too busy to realize the importance of.
I think that is one thing. Doing these podcasts, we wanted to share everyone's stories. And yes, this is devastating on so many levels for so many different reasons. But we've seen in just the episodes that we've done so many positives. One constant that has been pretty much throughout is exactly what you said. The return of the family dinner, the return of the family conversation, the return of the family activities. And quite honestly, that's a blessing, because I believe our family life had gotten
busy.
Spread out and busy. Yeah, absolutely. So
I think that we were so easily distracted by things of the world and things that we thought were, you know, really mattered or meaningful, that it took something like this to slow us down. And I have said numerous times, I have such a different level of clarity just in my day-to-day activity that I haven't had for so long, because I don't have the distractions of, is my flight going to be on time? Is my reservation in the room going to be correct? Where am I going to eat breakfast, lunch, or dinner because I'm on the road? I mean, there's so many just small things that you don't realize when you're in the midst of it, that this has provided that ability to have clarity. And for me, it also is about faith. You know, I'm a strong person of faith, and unapologetically, I know that this has grown my faith and has helped me to just remember really who's in control of everything.
Absolutely.
Right.
What shifting gears just a little bit, because we didn't get to touch on this. AAN is a nonprofit.
Yes.
What, moving forward, fundraising, you know, receiving grants, if that's part of it, how has this impacted? What do you see differently?
Well, so the network pivoted very quickly. Actually, on March 17th, we decided to host our first COVID webinar. And since then, we've held a COVID webinar every 10 days. So for the last 70 plus days, we have held, you know, a webinar and on various topics around allergy, asthma, COVID, mental health, everything related to COVID. And we've developed infographics and resources. And so that has helped to ensure that we had incoming revenue and certainly new grant sources. Because again, these webinars on average draw over 3,000 people every 10 days. Wow. So in the last, 70 days, we've engaged now well over 20,000 people with these webinars and the different downloads associated with them.
Wow, those are big numbers. To make that switch that fast and to pull those kind of numbers. But I also feel like the other plus, I guess, that you can see from this is that new people that may not have known about AAN previously, now through people who share and choose to, the new people now they have a way to go and to take a part in or get the information that they need. And so you are gaining new followers, if you will, for lack of better terminology, which again is another plus. I always like to try to find the pluses.
Yeah, it's absolutely a silver lining in this whole COVID, scenario, that we've been able to engage new people. And then it also has allowed us to accelerate a very specific program that we've been working on for a couple of years with telehealth So we have been developing a telehealth platform with asthma coaches and allergists and pulmonologists, and also licensed clinical social workers and behavioral psychologists to support patients in their journey. And now, finally, in light of this, telehealth is advancing so rapidly, and more people are willing to do telehealth than ever before. And so we're very excited about that project. And again, it's also been a new funding source. So I don't want to paint too rosy of a picture, because definitely there have been challenges. Donations slowed with unemployment at greater than 10% across the country. Definitely these are difficult times, and we still need everyone's support to be able to continue to move the mission forward. But we are very grateful for the way that the provisions that have been made and for the new grants that have been secured in these times.
Just curious, the telehealth thing that you've talked about, I had to do my first quick little conference with a doctor last week. It's a bonus to not have to get in the car and drive and so on and so forth. You can cover a lot of ground without having to do that. I think corporations are finding out that they have a lot more tools at their disposal to have people work at home and not drive and keep the roads clearer and less pollution, so on and so forth. Again, more silver linings to the situation.
Yes.
In the case of AAN, are these people that are calling into AAN for advice and so on and so forth, and you've set that up through your organization?
Yeah, so we have a platform called American Well, or AmWell, that offers primary care visits, specialist visits, and asthma coach and food allergy coach visits. And so you can go to allergyasthmanetwork.org or to the AAN telehealth.amwell.com and access those coaches at that site.
Is it specifically for asthma-related conditions, or does AmWell end up? It's a global kind of access.
It's broader. Yes, okay. You can have a virtual visit for any reason, but yes, we do have these specific coaches that are trained in certified asthma educators, and also certified trained licensed clinical behavioral psychologists and social workers in food allergies specifically, because there are a lot of unique psychosocial aspects to living with that condition.
Right, there certainly are.
Yeah.
You're a very busy woman, Tonya Winders.
Yeah.
Amazing.
I said this today, we were talking to someone else, and I think it's very important for our listeners to hear, and also to know that resource is available to them, because despite the fact that so many conditions have been put aside or gotten less media attention because of our little friend COVID, it's great to know that those resources are available. Allergies and asthma, they keep happening every day. People keep struggling with them. It didn't go away because of COVID. So having AAN and the telehealth and all of the resources, the webinars are amazing. And it's just, I hope listeners will seek that path that don't know about you guys.
Well, I hope so too. Again, just today, we also launched our new website, allergyasthmanetwork.org, and there are a host of educational resources that are easy to understand. Again, whether you want to learn more about COPD or nasal polyps or, hives. I mean, there are so many conditions that kind of fall under that umbrella of allergies, asthma, and related conditions. So I hope that people will find those resources as well and connect with us.
Absolutely. We absolutely cannot wait to be together with everyone next May. Yes. I think it's going to be an amazing celebration.
Absolutely.
Don't get to hug your neck now and then. We will definitely hug everyone's neck then when we're there. I just can't say enough about how much Capitol Hill Day means and what an impact it made on us when we experienced it for the first time.
Definitely.
Well, we are looking forward to you guys being there and certainly sharing your testimony more broadly with members of Congress on that day. And we would invite all of your listeners, all of your viewers to come and join us. This is an open event. We will provide travel support so you can come out and really raise your voice as not only a person impacted by allergies or asthma, but as an American citizen. You know, just recently I heard a statistic that was very concerning to me. It was just over 55% of Americans that actually voted in the last federal election, and fewer than 20% of Americans that voted in their last state or local election. And so we really need people to recognize the responsibility and the importance of getting their voice heard.
Absolutely.
Without question. And thank you for everything you do. And we're honored that you're our friend as well. So all the
Thank
best.
you. I appreciate you guys.
Yeah,
Thank
we appreciate you too. Thanks for
Likewise.
sharing your time. We know how busy you are.
We will
Yeah.
bring a busload with us.
Continue blessings. Take care.
See you.
You too.
Bye-bye.
Bye-bye.